Hi everybody, how's it going? Sorry I couldn't be here today. I hope you're having a great week. I'll be presenting my PBL objective today, lung cancer, and I'm going to be covering four topics: the classification, screening, investigation, and staging of lung cancer. Lung cancer is one of the most common types of cancer nowadays. Its incidence in North America is decreasing, but elsewhere in the world, such as in China, people expect a large lung cancer crisis in the coming decades. Lung cancers are classified into two types of cancer: small cell carcinoma and non small cell carcinoma. Non small cell carcinoma accounts for 80.4% of cancers and includes squamous cell carcinoma, adenocarcinoma, and large cell lung cancer. Non small cell lung cancer is the type of lung cancer that can present in people who have never smoked in their lives. It is associated with certain carcinogens, though, such as radon. Small cell carcinoma, on the other hand, isn't as common. It accounts for 16.8% of lung cancers, and its occurrence is directly linked to smoking. Again, both forms of malignancies are very lethal. Currently, there is no routine screening for lung cancer. There are some studies underway using CT scanning in people who are at high risk of developing this type of malignancy. Some results show positive conclusions, others not so much. Still, the investigation continues in regards to the use of CT scans for screening. Also, very promising technology is that researchers have been working on developing a sort of breathalyzer test whereby you breathe into a machine when you go to see your family physician, and the machine detects carcinogenic DNA in your breath that is able to identify cancers before they even present with symptoms. However, again, this technology is very new. It's still totally investigational, but if it does work out, it would really revolutionize the way we identify lung cancer, and would hopefully save a lot of lives as a result. When people do present with lung cancer to their family physician, they usually present with symptoms such as cough, dyspnea, sometimes hemoptysis, like in the case of our PBL patient, Mrs. Butler. They may also present with wheezing, chest pain. Oh, wait, actually, no, I think not chest pain. Sorry. The initial investigation when somebody presents with lung cancer with these symptoms is a chest x ray and a focused history to determine whether they've been exposed to carcinogens. Obviously, the first one that comes to our heads is smoking, but there are many other carcinogens as well, especially industrial toxins, asbestos, and one thing that surprised me was radon. Radon is it's a naturally occurring element that's found in just anywhere, but it can contribute to lung cancer. And the concentration of radon is different in different locations depending on the composition of the soil in that area. So, for example, Idaho has the greatest incidence of radon related lung cancer in the United States, which I thought was really interesting. I hadn't heard of that before. But back to the topic. um, the primary investigation is a focused history assessing for exposure to carcinogens and a chest x ray. If a chest x ray does come up with a positive result, an image that looks like it's lung cancer, the secondary investigation would be a bronchoscopy and a CT guided biopsy of the tumor to determine the type of tumor that it is, the type of lung cancer, and use this to provide the best possible treatment. Finally, the staging of the mass itself is according to whether it's a non-small cell lung cancer or a small cell lung cancer. The non-small cell are staged using the TNM system, which accounts for the tumor, the lymph nodes involved in the area of the tumor, and whether they're metastases or not. On the other hand, small cell carcinoma is staged using other factors such as gender, the stage of the disease, as in its progression, its size. So a little bit of overlap with TNM right there. And also the involvement of other body systems such as the central nervous system. Again, the prognosis for both types of lung cancer, regardless of the stage, is generally poor. Um, Lung cancer is, it's not like other cancer, it's not like testicular cancer that has a high cure rate. Lung cancer is really one of the worst ones you can get. And regardless of the stage, the prognosis is generally quite poor. I'd like to answer your questions, but unfortunately, I'm not able to. I guess you can email me if you want to. Have a great reading break and enjoy the rest of the session. I'll see you soon. Bye.